why is it very risky to everybody? I understand everyone wants to look good, but why the extreme? Maybe from there.
Sure, yes. Yes, so look maxing, like you're saying, it's a new sort of trend, a cultural, this pop culture, young generation trend that has come out from this one gentleman or young, kid, clavicular that I'm learning as well, that I've learned over the last couple of weeks since it's been popular. And really, look maxing is this idea of going to the absolute extreme and having this obsession about your looks. And the reason that they're saying, okay, well, this idea is that look maxing is going to somehow help them in a number of aspects, whether it be attracting a partner or getting ahead in a job or somehow getting ahead in their social circle. They believe that this obsession with their looks is going to be advantageous to them in those certain aspects of life. Now, look maxing, so there's range. There's like hard maxing and soft maxing. And I think clavicular is falling under that idea of hard maxing, where they're going to the extremes and the obsession of improving their looks. And by doing that, the extremes, meaning things that are unsafe, things that are not medically proven, or things that are being used in either taking things that are used in the medical industry or in like the supplement or medication history, and they're taking it to a level where they were not intended to be used in that way. What the reasons why it's unsafe essentially is because there's no, for look maxing, particularly in regards to bone smashing, that this young kid is doing, there's really no evidence, and there's no medical or scientific proof that this is going to achieve the results that that clavicular is trying to say it achieves. He's trying to say that by using a hammer, essentially to hammer your bones, your facial bones, that you're going to be able to achieve a more masculine or structured look. However, in reality, what this does is this idea of bone smashing is it's creating trauma to the bones, and it's creating inflammation, scarring. It can lead to fractures, depressions, and overall asymmetric appearance to the face, and actually a look that is potentially worse excuse me, than what the individual started at. So it has the ability to lead to far worse complications, not only in the immediate time, such as fractures and depressions and pain and inflammation, but in the long term by creating uneven and asymmetric scarring, because you can't control how you scar. It can lead to long-term aesthetic issues.
What's the worst thing that could happen to anybody? I mean, assuming that we're trying to educate them about the dangers of look maxing, right? What's the worst possible scenario in Europe? Do you know that could happen to anyone who, well, continues to do with it, even despite the risks?
Sure.
Well, depending on what procedure they're trying to do, if it's actual bone smashing, you're breaking your bones. In your face, it's a very structure. You have all network of nerves and blood vessels that enter in and out of these tiny little foramina or holes inside the bones. So imagine if you break your bones somewhere along those little foramen where nerves are coming out. That's going to heal improperly, and you get nerve impingement. You can get paralysis in your face. If you damage a blood vessel, you get blood supply issues to your skin, which could lead to wounds. So there's all these sorts of bad complications that could happen that no one really thinks about, because, again, these might be rare complications, but if they happen, they could be extremely, extremely severe. So
we're talking about luxurious appearances, and how about in the case of the heart? Does it have anything to do? Because when our body can take only so much when it comes to pain tolerance and something like that. Would this have any implications as far as the heart or the neurology?
Well, again, it depends on the patient, every individual patient, if they have any pre-existing or risk factors. For example, if it's someone a bit on the older side, they have high blood pressure, diabetes, or any kind of comorbidities that put you at a higher risk, then there can potentially be. But as far as simple bone smashing, it shouldn't, if you're young, otherwise healthy person, it shouldn't really affect your heart that much. But again, there's other stuff like medications. People are using a lot of peptides. Those peptides can absolutely affect your heart because some of the peptides, like the growth hormone pedagogues, they do initially increase your heart rate. So if you accidentally inject a high dose, your heart rate could jump up to the 150s, 200s. You could get arrhythmias, and you could actually die from that. So you got to be really careful with what you are injecting in your body, and it should be done under the guidance of a physician because it is very scary what's out there. You don't know what's coming from different countries. It's not regulated by the FDA. You don't know what you're injecting in your body. So if you're going to inject anything that's injectable, it should be done under the guidance of a physician.
That's true. That's true. Okay. Well, right now, is this the well? I'm just trying to figure it out because everybody wants to look good. I mean, some sort of exercise, some because of the diets, but this is the first time I've heard about Looksmaxxing.
Yeah.
What's the best advice you can get to people who may have heard of it, but they haven't tried it? I mean, is it advisable to try it, or if they do, up to what level should they try it?
Yeah.
Sure, yeah.
So Looksmaxxing, I wanted to extrapolate on this too. So they compare it to trying to maximize, to squeeze out the most as you can from your looks, like squeezing the last drop of fluid out from a lemon, and you're trying to put out with your looks. That's what Looksmaxxing really is. And they compare it to, for example, a video game character that you create a video game character, right? You could add a bigger head, bigger biceps. So now they're trying to extrapolate that fake video game life to real life, and it doesn't really work that way. So on that point, as physicians, make our Hippocratic oath. First, do no harm. Primum non nocere. So we got to think about what are we going to do to our patients to not harm them, and it's really a fine line of where are you causing benefit versus where are you causing harm. So if it's any kind of injectables that you're doing, it needs to be done under the guidance of a physician because you don't know what you're injecting in your body. You don't know the dosage. You don't know how to manage the complications if there is a complication. And as far as the bone smashing, I think you should not do that at all because there is no medical indication of smashing your bone. And I think Dr. Bawa can extrapolate on this as far as Wolff's Law. There's certain theories of how putting tension on your bones can make them stronger or bigger. I'll let you explain that a little bit more.
Yeah, absolutely.
But it doesn't really relate to Looksmaxxing.
Right,
Yeah.
right. So with Lookmaxxing, I say, in general, it should not be done at home and it should not be done by the patient themselves. Anytime someone is looking to improve their looks in a dramatic way, they should seek a professional. So a surgeon, a physician, to get a professional opinion about how they can do it in a safe manner and what is going to be appropriate. This whole idea of bone smashing Looksmaxxing came from Wolff's Law, which was this idea that bones have the ability to adapt to a physical stress, adapt to a weight-bearing load, and remodel. But that does not. They are taking that and they are trying to misinterpret it and say that that is how bone smashing works. But that's not what Wolff's Law is saying. Wolff's Law was saying that these increased load was for over time and with weight-bearing exercises and resistance. So the whole idea of like physical therapy and continued movement and strength, that is what Wolff's Law was referring to, not to what they're trying to extrapolate and put into bone smashing. Now, in that regard, if there is someone who wants to change their looks in a dramatic way, there are safe alternatives, such as going and seeing a cosmetic or plastic surgeon, inquiring about approved medical implants, inquiring about approved injectables and where they can be safely used. So there are alternatives and much safer and regulated alternatives. So I think Looksmaxxing at home is just an absolute no-no.
I understand. Yeah, I agree with you. There are alternative ways. I was going to ask that. Cosmetic things. So
another thing is, for example, all these influencers, Clavicular or any other of these influencers, what are their credentials?
Yeah.
Is he a trained physician? Let's say if he gives you a recommendation to smash your face, if you get a complication, who is responsible for managing that complication? So it's kind of very irresponsible on the influencer's part. And again, not trying to point out him in particular, but just society as a whole. We need to be careful where we're getting our medical advice from. You shouldn't get it from a young 20-year-old kid who has no medical expertise. He has not gone through med school. He's just done research on Google, but there's a whole lot of complications that you can see, which is again very responsible on their part to try to give that prospective patients or young kids who look up to them. So I think it's very responsible. And us, society as a whole, we try to look up to these kids with social media, with the whole clickbait, the whole like culture, where you do something so extreme just to get views. And I think it's, as a society, it's very irresponsible on our part for rewarding that kind of behavior instead of rewarding someone who does good in school, for example, or someone that was able to find a cure for cancer. But just society is really backwards right now.
Yeah, well, I would agree. I mean, when I heard about it, it's really extreme, and now hearing it from you, it is really extreme. So I don't know. Would you know when? I have no idea when this trend started. Would you have any idea when this started? This Looksmaxxing thing, or it's just
I'm not
recent?
Yeah, I'm not sure when it initially started, but I do think the attention to it has been recent. I think, there has been a culture, a subculture of people who have always been very into their aesthetic appearance and were doing a lot of things. But I think it really came more to light into mainstream probably in the last month or so because of this young. But that's not to say that it didn't exist prior. I just think it became more evident and became more part of the mainstream media in the last month.
I mean, everyone's always been trying to improve the way they look, and we're in that business too. We're in the business of helping people look better, but the way we do it is it changes the way they feel about themselves too, because there's certain standards we follow. We try to make them look natural, better. But as far as Looksmaxxing, it's been around for very long time. Like, you've seen those people who put implants under their foreheads. They look like aliens. They cut their noses to look like it. So there have been not a lot of people, but it's been around for quite a while. But it's been getting a lot more attention the past few months because of these new influencers, and with social media, everything, all this information is so readily available. So it looks like it's more available now, more in the mainstream now.
Yeah, well, with the generation we have right now, they're very daring. I mean, you don't look at the things that we're talking about right now, especially the science part, the medication part, the health part. They don't consider that actually. They just believe in what the influence because they look good.
Yeah,
So
absolutely. I think that's so social media and all that it's so powerful,
Yeah.
right? You can have wonderful and amazing things and the ability to disseminate information that is positive and great, but then on the flip side, right, you have issues like this where you have such a reach and access that you're disseminating information that is also dangerous. So unfortunately, I think that's what we're seeing with this clavicular kid, is this dissemination and this reach to impressionable young people looking for the quick change and looking to fit into society, because I think, as humans, we are always looking for what's fast, what's going to get us the goal that we want in the shortest amount of time. And I think that's sort of, when you present something like that to impressionable young people, they're going to grab it and run with it. And so I think that's the danger with this issue here.
in short, there's
Except
no.
for our kid, but he was recently hospitalized for doing crack. Why would you take life advice from someone who was just hospitalized for overdosing on crack? Something to think about,
Yeah, that's true. So in short, there's no really shortcut to looking good. I mean, just like you have to work it, you work for it, right?
Yeah, I mean, you have to work for it. Now, like I said, there are alternatives that are safe, but there's no overnight, do it yourself at home. It's it's something that requires sometimes the help of a physician, a surgeon, and time. You know, it's like with anything when, you know, you're trying to get in shape or build muscle, it takes time. Time, commitment, dedication. It can be done, and it should be done if you're wanting to do that in a safe way.
All right. Wow, thank you. Those are good information. Before we end, maybe as a parting shot, what is the best advice you can give to the people who may be planning to do Looksmaxxing? I just have to put that. When I write this, I want to put that the message, a good message from you.
Yeah, I would say that first and foremost, these people to be careful. Do not try and do anything at home outside of the hands of a medical professional. Right now, there's accessibility to a lot of these things is very easy, and with social media and all of this, the, you know, how to's and the guide how to do it is very easy. But I want people to think about there are both immediate and long-term effects of doing these things at home and not under the guidance of a medical professional that can lead to dangers and long-term have long-term negative impacts. So I would, you know, be careful, think twice, and put your health before you put your appearance.
How about sir?
And as a young person in your teens, your early 20s, your body still hasn't completely fully developed. So you're not looking what you're gonna finally look like. So give it some time, focus on yourself. And if you're thinking about injecting something, I can't think of a single injectable that does not require a prescription. So if you're getting something online, chances are it's not going to be good quality. So if you're getting an injectable, it should be from a qualified pharmacy. And to get a medication from a pharmacy, you need a prescription. So just I urge this to all these young kids: don't buy stuff from online because you don't know how it's made, where it's sourced from. You don't know what you're injecting. You could be injecting jet fuel in yourself. You don't know. So just be extremely careful.
All right. Thank you so much.